The following is brought to you by Vertical Vet. Rethink your GPO.
Good evening, Vertical Vet fam. I'm super excited because we're bringing a little bit of a different panel today. So it's a little different structure than what we are used to, but we have one of our platinum managers on here. She's beside me on this call, so that's why I'm pointing this direction. And it's Sam Maloney, and she comes from Kind Care Animal Hospital, one of our platinum practices. Super pumped to have her on. We have Lindsay, who's below me. She is a member resource advisor here at Vertical Vet. She's absolutely fabulous. And then we have Katie, who directs our virtual practice management program, who is also very fabulous. So we are here to talk about communication barriers in the practice today, and to talk about how those happen, whether it's front versus back, whether it's staff versus management. We know that this is a problem that all practices experience, all things that we have to deal with on a regular basis that come and go. And so we want to talk about warning signs, how this happens, how we fix it, and ensure that things like this don't continue to happen. So I'm super pumped because this is a topic that we know is going to bring some great discussion. Please put your thoughts in the comments below, because we love hearing your feedback on these. That's what helps us grow. That's what helps us schedule these. So without further ado, I would love to dive in. We talked a little bit about this beforehand to decide, guys, what are our common issues? How do we fix this? What have we seen individually in practices that we deal with? And Sam has especially dealt with front versus back and has some wonderful perspective on it. So Sam, without further ado, take it away, girl.
So we have a 6-doctor practice. I have anywhere between 15 to 20 people to manage all at one time. That's front to back and doctors all included. So we have experienced some of this, like front to back, not knowing what we're supposed to be doing. Just the communication from front to back to front, all over the hospital. So what we've kind of done in the past that we utilize today is basically just knowing what each position does, from the hospital assistant to the VA, which is the veterinary assistant, all the room technician, surgery technician, the person in the front, check-in section, the person in the phone room, like everybody has a job description and they're posted and also given at the beginning of each person's first day. You have everything that you need. So basically just knowing like what the front does versus what the back does. So you kind of just have that whole job description. That way you directly communicate, like if we have an ultrasound here, who's responsible for doing that? So when the front checks them in, okay, now I know to go to this person because they're in that position today. So that's kind of one of the things that we've implemented in our hospital in the past that we use every day. So it's been very helpful.
That.
Yeah.
Sam, honestly, we talk about roles and responsibilities so much and how important those roles and responsibilities are, because the thing is, we cannot take staff and put them into positions and expect them to just know based on a practice that they worked on in the past, sink or swim. We've proven that that doesn't work in veterinary medicine anymore. Right. It is destroying the culture, right? Because we're putting people into positions that they are not prepared to take. And then we know what happens when that happens. We start to assume that we know what other people think about how we're doing. And then we start to assume that we know what other people are doing. And Lindsay, I know you spoke on this, where it's, hey, that person isn't helping me because they don't want to help me, not because they're holding for the fear-free nail trim, right?
Exactly. And it's that just because you can't see what's going on, or, this is what so-and-so does all the time and it should be up to them. You have to have that open communication. I had an experience one time where it was a little bit of a front versus back. And it was well, I'm the one that always does, and I'm the one that always does. And it turned around that I was the one that always did XYZ, but she did ABC. And I never did ABC because she always did it. And so once we had that conversation of, we're essentially working together to get things done, but we haven't talked about it. And so it was this sort of like bitter, angry, why do I always do this? And it's because you always do that, so I don't do it. So just even silly stuff where it's head fighting, right? You're fighting in your head with somebody, but there's no reason to. So once you open up that line of communication of, no, we're working together to accomplish these things. So super silly stuff like that, just having that open conversation about, this is what I do. What are you doing? Not in a negative way, but just as I don't know what your day-to-day looks like. Tell me about it.
Yes. You know, and when you say that to me, Lindsay, when you guys are talking about, I'm doing ABC and you're doing XYZ, how did you guys even know there was a problem? How did you recognize, oh, somebody's feeling something here? And how did you pick up on those warning signs and move forward to address it?
Unfortunately, in my case, where this conversation happened, it was an explosion. It was if I'm honest, I can't remember the specifics of it, but it was something along the lines of, somebody said, why didn't this get done in a unfriendly way? And I was like, because I've been doing blah, blah, blah. And all these things happened. And so in my case, it was an explosion. It was building, it was building, it was building, it was building. Having now been in that conversation, having that happen to me, I feel like you can start to see it. It starts with little comments. She never does blah, blah, blah. I'm always the one doing blah, blah, blah. And so when that happens, you have to be like, tell me what you do. What are you doing? And what do you feel like somebody else isn't doing? Start that conversation before it hits that point where you're going to explode. So it's always that it starts with a little, I'm always the one that has to, how come so-and-so never does? And if that's the case and you need help with something like that, you have to open up that line of communication and say, hey, I'm feeling like I'm the only person who cleans the autoclave. Well, while the rest of the team is like, well, I'm not going to clean the autoclave. Angel's always the one that cleans the autoclave. I don't want to step on her toes, right? And so it's always like that slight miscommunication. So trying to be aware of, if you see that somebody is getting frustrated, or I call it the huffy. It's fine, I'll do it. The huffy. If you start to see the huffy body language, I mean, that's what we do in vet med, right? You read a dog's body language. Is it a lip curl? With people, it's the same thing. An eyebrow lift, the huff,
our nonverbal communication is so important.
Yes.
It is so important.
And I think trying to take care of it then and there.
That's what I was going to say.
What are you feeling? Why do you feel that way? Let's have this conversation before it escalates.
Yes. Because that's the thing, is addressing things head on is why I think things get out of control. Because, and Katie, you've heard me speak on this so many times, if people are not good communicators at work, they're not good communicators in their personal life. They don't know how to fight with their spouse. They don't know how to talk to their friends, and they don't know how to set boundaries with their family. These are all things that they struggle with doing. And so if they can't do that in the workplace, they cannot do that elsewhere. So if we can teach our staff and help them by mediating as a third party, if that's what's needed, so that they can learn how to not be afraid to say, hey, this upset me, or to say, hey, why are you doing it that way? It helps us grow so much to be vulnerable in that moment and say, I don't know why you're doing it that way. It's not a bad thing. It is scary initially, but when you see that you can learn instead of assume why another staff member is doing something. I mean, Katie, we've talked about this so many times. I'd love to hear your take on how and why we don't let things fester and address them right then and there. And Lindsay, I love you for being honest, talking about how it exploded, because truly that's what happens in most practices and practice managers. And Katie, I'm going to pass this to you in 2 seconds, but I want to say, make sure you guys are back there. Make sure you're paying attention to your front versus back, how they're talking to each other, because that's how, when our staff aren't communicating and not communicating to us as well about a problem, that we have that red flag of like, something's not right. This person who's always smiling and happy in here is huffy today and seems very frustrated and overwhelmed. So what's going on? So I'd love to hear your opinion on that, Katie. Absolutely.
Yeah. So, I mean, I definitely think that, like Lindsay said, it all boils down to communication and taking the opportunity to have that communication when the issues arise and you see this body language, or you see them being frustrated, or their attitude is different than what they normally are, to really recognize that and be a part of the situation. of solving the problem and figuring out what's going on. One of the other things that Sam talked about before we got on and when we were brainstorming and stuff is cross-training the staff and having them, you know, work in the back or work in the front, or at least observe back or forth. And then having someone on those teams that is cross-trained. So, you know, like she was saying, is that one of the things that she's had happen in the cross-training that she's done in the practice is that they have really been able to stick up for the back or the front. And I can definitely experience that myself, because I started at the front. And so when I got into management and I spent more time in the back, and they're always moaning and griping and complaining about the front, I would be like, well, this is what's happening up there. You don't understand what they're dealing with. They're probably getting cussed out by a client or whatever. They have this person who's like screaming on the phone or crying or doesn't know what to do, or they're an elderly person and they don't even know what they're talking about, and they're trying to work through this with them and figure out how to get a solution to their problem, and all of the communication that they have to do with the clients. And then they're constantly getting people, you know, upset about how much they're having to pay them, like that's how much it is, and they're having to deal with that. And so they have a lot of things going on with them. So I was constantly like, well, what about this? And think about what they're going through. And it's the same thing for the front and the back. Like Lindsay was saying earlier, when you call back and they don't answer your page right away, you know, instead of getting frustrated, to say, you know, they're probably doing something. They probably have a patient. Maybe there's an emergency. Who knows? One of the post-op patients might have crashed, and you can't see all of that going on at the front. I've always, you know, said, and we talked about this in practice, is like it'd be really nice to have a camera like underneath the desk that not everybody can see, just the receptionist, so they can see what's going on back there. And you're calling for Lindsay and she's like wrestling this dog and like looking up at the phone, like, I can't, what am I supposed to do right now? Like, I'm all in on this, you know? And so, you know, having that cross training type of thing, and just people knowing what the other person is doing and having those open conversations. And when you see this, you know, being a problem in your practice, addressing it head on, even in, like, if you did it in a staff meeting, let's do some role playing of what you go through on the day-to-day basis. As a technician or as a receptionist. Let's tell some stories about, you know, patients that you've dealt with or clients that you've dealt with, and let's feel our emotions and our feelings and what we're going through on either side of this, and try to come to a mutual understanding of everybody's working as hard as they can for the common goal of treating as many patients as we can.
Yes. And, you know, the thing that you said about cross-training that really resonated with me, and that I hear over and over again, talking about how they know what the other person is doing instead of assuming. Also, guys, increasing the efficiency of your hospital starts with cross-training. When you have a receptionist that can hold and for a blood draw or can draw blood, when you guys are chaotic and you have two receptionists up front and can spare one, or vice versa. I remember one time I had just stepped away from a dental and all of us were cross-trained. I was just about to pick up the owner to call to go over an estimate, and the phone started ringing. And next thing I knew, I had 4 lines that I had to put on hold back to back. And all I could think was, oh man, I'm so glad that I know how to do this, because if the receptionist cannot put these 4 lines on hold, I can't even imagine what's happening up there right now. So it's like, guys, imagine how efficient your clinic is when you have a patient come in for a blood draw and there's no one to hold that dog, but a receptionist can. And same thing when your phones are ringing off the hook, it should just be a rule in your practice. If your phone rings more than 3 times, somebody's answering the phone. It doesn't matter who it is. And that in general just increases efficiency. As long as there's good communication. Hey, I put line 3 on hold. I want to let you know, here's a sticky note. Note, don't forget about it. And then make sure you have your tone reminder when a phone line's been on hold for too long. Things like that, these little practices that we put into place allow them to appreciate each other more, allow them to understand what that other person is going through more. I hate that they might get cussed out by a client, that they might have someone get sensitive with them about price, or they might have a dog that scratches them when they roll and fight. But it gives everybody a taste of what that person is dealing with on a daily basis. And it's such a newfound respect. And I just love that.
Katie,
go ahead, Lindsay.
Your comment about the role playing during a staff meeting, I think is huge. I was at a clinic one time where it was, we were trying to just keep up to date with like people's phone numbers, right? Phone numbers and email addresses was always like the problem in our clinic, like emails getting kicked back. And so one of the things that was suggested was when they check in for their appointment, we need to confirm you're still at this address, phone number, whatever, all this information.
Yes.
Even like a secondary contact, right? If they got divorced or whatever. And so it started a good conversation of we asked the receptionist, do you think this was something that you could do? And it turned into, why can't the technicians do it? Which then turned into, because we're doing, and they were like, oh,
Yes.
So it's a great way to sort of, when a client comes into this building, let's walk through everything that happens. You check them in, you do this, the paper, the room, tell the tech. It was an amazing way to literally walk through what happens in a client experience when they come into this building and what responsibilities go to who to make sure XYZ doesn't get done. And in some situations, right, you're just throwing the person in the room and you're like, somebody will be in, and you're running back up front, in which case it was I didn't ask them about blah, 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 and they run back, great, fine, then I can take care of it. But if it's ideally, so-and-so does this part, if they have to pass it off, this gets passed off. So again, great way to sort of who's doing what everybody's doing in their job. But again, being able to start that conversation of, I was not able to because the building's on fire, or whatever happens to be going on.
Or someone
Lindsay, you
ran
said
into
something.
the front of your building.
Yeah.
That's happened before.
That's happened.
Turned in, kept going.
I will say, to, continuation of Lindsay's and Katie's, knowing everybody's, like a lot of times when you start a job, you just get your job description and like,
Yes.
this is what I do. It helps when you pass, like, you probably know that this person's going to be more of a surgery technician long-term.
Mhm.
However,
Yeah.
this is also, you need to know the hospital assistant position, because who's doing laundry? Who's responsible for doing laundry? And if that person's out, who's the next person that's responsible for doing laundry? So it's kind of, it's just like knowing who's doing what. And then I also, like she's saying, getting history and things like that. If it's the receptionist position, responsibility to get the history, and then you're like, hey, I did not get that, versus when the technician goes in and they just assume, then now that client doesn't have, the doctor doesn't have a history from that client, and now you have a bad client experience because they're like, no one's asked me anything. So
Yes.
just knowing
And you know
what
what?
you're doing and what
I
other
love
people
this,
are supposed
Sam
to
and
do.
Lindsay, because when we chatted about this, I don't think one time we brought up the client experience until we started this. And I love that naturally, that's something that you guys are thinking of in the back of your mind, because that when you said it first, Lindsay, and then Sam, in my mind, I was like, oh my gosh, the client experience, we all know if our culture is not where it should be, that the client is almost immediately affected.
Mhm.
And what kind of experience does that deliver when there's animosity between the front and the back? They're not effectively communicating. They're not transitioning rooms appropriately, not checking people out on time. All of these things affect that client when they have that. And then Sam, you kind of transitioned us perfectly into our next topic, because you talked about knowing the roles and responsibilities for everyone in the practice. And something, guys, that triggered this whole thing was this beautiful lady below me, because Lindsay once said to me, when I was in clinic, in some practices that I was in, I didn't always know what our practice manager was doing. And that was really eye-opening for me as a PM, because I was like, really? Okay, I would love to chat with you about this, because there's so many things that happen on the back end that we feel as management, gosh, our staff just has no idea the sacrifices that we're making on our end of things. And so I want to finish out this talk with, when we have the management versus staff communication barrier and where that begins. And Katie, you talked on this. I would love to hear you go into it, because you have an amazing experience that I feel a lot of managers have either gone through, whether it's coming into a new practice or having a new staff member that's, maybe like a 20-year CBT coming into her clinic and not knowing and being used to the way that that manager does things. So I would love, Katie, if you'll touch on that. And then Lindsay, I would love also for you to dive into your experience too.
Yeah, so I think the thing that's important to consider is, as a manager and in these leadership roles, sometimes we fall into this, do this because I said so type of mindset. And I think that is where you, get yourself into a problem, because especially if you're new to management, whether you were promoted within the clinic, you fell into this role for whatever reason, or you were hired as the manager in the clinic, that you still have to build the trust and relationships with your staff. And that boils down to effectively communicating what you're doing it and why you're doing it, and really letting them understand your why and your goals of the practice. And like every decision that you make really kind of comes back to that, and it's full circle. And, in time, what you'll get from that is you're going to have staff that are going to have buy-in, and everybody's going to have this common goal. They're going to know that, this is what you're here for. This is what you're trying to accomplish. And that's the reason why you're making the decisions that you're making. And you don't have a problem explaining why you did what you did if they come to you and ask, or you feel like it needs to be explained to them. And then when you get into the heat of the moment in a situation and you have to make a split decision, there's not going to be a lot of questioning you. They're going to be like, okay, she knows we've got some wins under our belt. We trust her. We know she's got this common goal. If we want to talk about it later on, we can, but we don't have time right now, but we're just going to go, and everything's going to be okay. And you build that trust with your staff that you're going to lead them in the right direction. And that is something that takes time. It takes effort. It takes you being cognizant of that and being able to, communicate with your staff and have them know what you're doing and what you're thinking and why you're thinking it, so that they can, understand everything and be on the same page, and everybody's on the same page with that. And they do know that you're working really hard day in and day out, for them, for the practice, and to have all these common goals and make their lives easier, the practice run smoother, the practice be more profitable, all of the things. And they understand that. And it just starts with, communicating.
Yeah, truly. Like, guys, if you're making a decision in your practice and you're not weighing in on your team with these, that is only your team being on the outside looking in. That only puts them there. And that only allows them to do the one thing that I know we've said so many times in this call: assume. They assume that they know that you're doing what you're doing. And it can be, oh, they just want the money. I think that's probably the number one thing I've had a receptionist or a technician come back on me on. If I told them, I want you to recommend gold standard care, when they've been out of practice that didn't recommend gold standard care. Oh no, you guys just want the money. Well, no, let me explain the why behind this. Let me explain the why behind why we do these things, so that you can have an understanding on why we recommend these things and why we recommend the gold standard. And it's because we want that to be the owner's choice and decision. We want them to make the gold standard choice, but if they cannot financially do it, et cetera, we're not judgmental. We're not kicking that client to the curb. We're going to work with them, but this is what we start with, and I think communicating that way and allowing that transparency with our team, that open door of just know that you can come in here and ask me any question. I will be honest with you. And Lindsay, I mean, you have a direct experience of what happens when that doesn't happen, right?
And I've had sort of the negative side of it and the positive side of it, with both being, I don't know what you do. I don't know what you're doing in the day to day. Like, there's the obvious things, right? Where it's like, hey, we're looking at getting a new whatever. Like, there's certain things like that. But I've had experiences where a practice manager left and I did not realize everything that she did. And almost to I didn't appreciate level, where I was like, wow.
It's hard to appreciate when you don't know
how much she was fighting for us, what she was doing to help us in the day to day, because she just did it. She just did it. And you didn't realize it. But then on the negative side of it, where I've been like, what are you doing? And part of it falls back on me, because basically what was happening was things were getting passed to me. And I was like, I am not qualified to do these things or handle these situations. What are you doing? And for all I know, she was drowning and was in the weeds and had no help, and I was default, but that was never communicated to me. And so then I felt like I was forced to be in a situation where I'm like, I don't feel like I should be having this conversation with somebody that this really should have gone to the practice manager. But when you're in the moment, what can I say? No, I'm not going to do it. Like, the client's here. This has to be handled now. So sort of both sides of it. Which again, I think is a little bit falls back on me. Just, I should know, or I should ask, hey, what's your day to day like? Because I don't know what you're doing. So I've seen both sides of it. And so, because I've never been a practice manager, and then Katie, Angel, and Sam hearing all that you do, I'm like, I am so sorry. I am so sorry. I had no idea. And so I feel like there's a lot of staff that feels that way, where we have no idea. We have no idea how you fight for us, or even like Katie said, where you're making these decisions and we're just sort of like, well, that sounds stupid, but we're trusting it on blind faith. And then if Katie was like,
Yeah.
no, the other options were even worse.
XYZ.
Exactly. And this was the best outcome that we could make, but nobody tells us that. So the staff is just like, this is stupid. Why are we doing this? So having those open lines of communication, explaining, listen, we were kind of dealt a crappy hand and tough decisions need to be made. And this is why it was done. Obviously, knowing you can't give us all of the details of specific situations, but even just sort of keeping us in the loop instead of just the office is sort of this black hole of mystery where we can come and pull you out, but we don't know what's going on in there. So being able to sort of keep that open and not so much mystery behind it.
Yeah. I mean, and Lindsay, we talked about this in the platinum meetings this year, and I think a lot of practices are starting to do it. Rounding with your team is super important, guys. 10 minutes in the morning is not that long that the hospital will burn down, clients will leave in the masses, and that you will absolutely struggle. I know it will be hard initially, but when you take that 10-minute meeting in the morning to say, guys, I'm doing payroll today, I'm doing this, I've got a handful of meetings. If you see a sign on my door that says don't interrupt, please don't, because it's XYZ meeting, it's important. But this is something that was really big for me, guys. I lived very far away from where my kids were in daycare. And if I did not leave my clinic by a certain time, I would be late to get them. So in the morning when I would communicate everything I had to do, I would also go, and I have to leave at 4:00 today, guys, make sure I'm at the door by 4:00. And I would have my text on the door. You have to go, get out right now. And but you know what? They didn't think I was leaving early to go do whatever. They knew I had to go get my kids on those days, and that was super important. There was never animosity like, oh, Angel's leaving early, because it was clearly communicated why. It was clearly communicated what I had to be doing. If I was in the clinic, my staff knew where I was at and what I was doing. And it's not so much, guys, that they need like an A to Z of where you're at and what you're doing. That's not the case. They need to feel like it's not a black hole of an office that they have no idea what's happening inside of. And when we are clear with our staff on what we're doing, we're clear with our boundaries, right? We're clear on when we're available and when we're not. There is a lot less blurred lines of, ooh, well, maybe I could do this, or maybe I could get away with this. It's a clear cut. Katie and Sam are amazing managers. They love me so much that they will absolutely hold me accountable. And they would give me the shirt off their back, but they are going to let me know if I make a mistake.
And it sort of comes back to the doing the rounds in the morning. It comes back to what Sam said, where if the front desk knows that I'm the one doing ultrasounds today, any ultrasounds appointment, they need to come to me instead of this, like, who's taking this one, who's doing, no, they know it's me today. If Katie's doing surgery, any surgery drop-offs, you need to go to Katie. So to be able to sort of have that organization, so the front knows who to ask in the back knows who to get in the front, and just, it opens up that line of communication. Also keeps us up to date. Angel's got to go by 4. So at 3:59, we're all like, girl, go.
Get out.
Exactly. To sort of have that as an option. But again, those open lines of communication, if somebody calls and that ultrasound appointment's running late, Sam can come to me. They're going to be 10 minutes late. Perfect. I can do XYZ in the meantime. It makes everything run so much smoother, and there's significantly less confusion. And then we all work together to help each other out. Make sure Angel gets out on time. Make sure I know that appointment's going to be 10 minutes late, which means maybe I can run in the back and eat something and maybe go pee.
Yes.
Yeah. I think the other thing too, with, having the open communication with what you're doing as a manager with your staff, is to have them understand, what you're doing on a day-to-day basis to move the practice forward, to better their lives, and all the things that you're doing to try and benefit them. Like, you're trying to get this program in place for EAP or whatever it is that you're got meetings about, and they know that that's what you're doing. And ultimately everything that you do has to do with moving forward, making their lives better, and they can see that. And I think that brings some appreciation to you that you might not get if they just don't know.
Because we don't know.
Because you don't know.
That's it. Because we don't know. We don't know.
Exactly.
Tell us.
So
I also
Sam, I was going to tag you in anyway, so you go for it.
I just wanted to touch base on like the line of communication. We thought about doing the whole rounding and everything, but we have a large staff. That's kind of complication number one. We also have different arrival times. So communication can come in all forms, and we chose the written kind for this. Back to like, we have a floor supervisor every day. It changes.
Yes.
And I can't expect everybody to remember that Tuesdays Sam is on the floor, Wednesdays somebody else is on the floor.
No, you're
So
right.
we have a board, you know, like if you're in the hospital, they're like, your nurse today is so-and-so. So we have your floor supervisor today.
I
is
love
blank.
that.
So if they have a question, they're like, oh, so it has really worked. We've just started doing this like, I don't know, 2 months ago, maybe, where every day the person who's on the floor, or if another manager gets to it beforehand, they'll write it on there. Like that name is up there. So like,
Yeah,
I'm
that's
not on the floor
great.
today. Did you read the board? And it also has like a
Yes.
hub of everything else that's going on. So like right now there's one on there that our ultrasonographer is out of town. Please don't ask me for an ultrasound because we're not going to have one. But here's your date. And if we need to, you know, go plan B, we'll go plan B. But it's just like an information hub because you do have
Yeah.
so many people to communicate with. And it's hard to say, oh, I already talked to, you know, A, B, and C, but I forgot, you know, D, E, and F over here because they weren't here at 7:30. They got in at 9. So
Yeah.
that way it falls on them, but it also falls on you. So it's a two-way thing, but it's just written and then they have to read it, obviously, but it's right next to the time clock.
I love that, Sam. I love that. And this is, guys, this is what's so important about having managers like Sam come on panels like this, because the one thing that we at Vertical Vet really love to be clear about is that we don't know everything, and that we have great
Neither do I.
suggestions, but there are so many ways to do things effectively and efficiently. And Sam just like really, really put light into that. There are so many communication apps out there. You can color code, you can use your PIM system, you can use whiteboard to communicate. There are tons of ways, but the overall arch that I'm hearing, Sam, is that it starts from the top and communication is the most important thing.
Yes.
So I'd love to hear your like, all right, guys, we know we have issues. We know that we have to better communicate as managers. How does that start? Where is step one? You know, there's a problem. What do we do moving forward?
Well, I would definitely say from experience, like in myself, step one is you. You have to realize like,
So good. So
You know,
good. So
you're
good.
not- listen, but if you're trying to get something across, and I have personal experience with this, like why did we have a 2-step like signing system in the pharmacy? Like if you fill the meds, you sign off. If you check the meds, you sign off, because you know we're all humans, we make errors. So now you have 2 sets of eyes. Why did that particular thing get through to everybody, but like this other thing over here did not get through? You have to backtrack.
Yes.
Did I say it correctly? Did I mean what I said? Did they not understand me? So you have to circle back to you. And then that starts trickling down to like, if you have an assistant manager, get them on the same page. Then it trickles down and down and down and down and down. So if you have the top tier, if you will, if that's what we call it, you know, then, you know, it starts at the top and then it will trickle down. If you're clear, then they can be clear. But I've definitely had to work on a lot of communication. I'm a communication major, but you know, not everybody is going to hear what you're saying in what you want to say. So like you may have said something, but you're like, obviously they didn't get it. So how else can I get through to them? You know, in a different way. You know,
we all learn differently.
Yeah, exactly. So you have to play to that. You have to play to that. And a lot of things that I've tried, I will definitely say the trust with the staff and just, you know, for them to come back. Someone advised me, and actually a lot of people have advised, I went to VMX in 2019, I think it was, and it was recommended at that time, and we're in 2022 here, to nix, you know, your yearly meetings and things like that. And Katie and I had talked about this a while back, and I finally adapted it. And I feel like there was a huge change when I went to nixing those, get rid of those yearly meetings. Nobody likes them. I've been doing them for 5 or 6 years. I've always hated them. So as like the person conducting them, and one-on-one meetings, you have that one-on-one time. And then now you've opened up another line of communication, like, hey, I'm here for you and I work for you basically. And I work for this practice. So I can definitely see the turnaround. We've only had one, and like the, you know, morale, the trust, everything is there. They feel more comfortable coming. And I think it wasn't necessarily a personal issue per se. It'd probably be the same, you know, if Katie still worked here, you know, like it's just it's a positional thing. It's never a personal thing. I don't think it's a positional thing. and they see you as like, I can't come to you. But if you break it down and you just sit there, all right, talk, like, you're not like, go, so like there's different ways, body language, barriers, like communication barriers. You put a table in front of somebody, they're automatically closed off. Open your chairs up, just have a more comfortable conversation. So it always starts with you. That's my advice.
Sam, my favorite thing you said is I work for you. That is like a profound moment. Because that's what it is. Yes, we work for the clinic. There's obviously the end goal. We work for the clients and the patients, but we work for each other. That's what this is. And so to hear a manager say, I work for you, like, I'm like, Sam, say it again. Just tell me one more time that you work. That's amazing. That is amazing, Sam. And I love that so much. Good for you. I think that's phenomenal. Phenomenal.
We just went through like a whole, it makes me a little teary-eyed too, but we just, everybody knows what the country's in right now. Like, everybody knows that veterinary medicine, we don't make a whole lot of money. No position in this, industry does. It doesn't matter where you work. But we went through this whole like payroll changes and things, and everybody got a raise but me. And I'm totally fine with that. I'm totally fine with that. I am here to work for you, not to share my, personal life with everybody. I don't really care how much money I make. I care that you guys can function and thrive, and that like, if money is going to be something that we have to work with, obviously as a manager, you have to keep tabs on like their pay and things. I want you to feel comfortable that you can actually stay with our company. And, if that's going to be a whole thing, we had to revamp our entire system. So, and I was like, I'm here to fight for you guys.
Sam, honestly,
Sam's staff,
that's where it starts.
Yeah, Sam's staff, know that about her, because that's something I didn't know. Nobody would have told me that. I would have just been like, woohoo, got a raise, moving on. But I didn't know that my manager, Sam, didn't.
I was very open about that.
Good.
And I was totally fine. I'm totally fine with that. And that's why I told them, I was like, I'm not here to work for me right now. I'm here to work for you. Right now.
I think being open with our staff is one of the best and most genuine things that we can do that makes us human. Like right off the bat, when I went through mental health struggles 3 years ago, I was very open with my staff because I was going to a lot of doctor's appointments. I was in and out of the practice a little bit during the day, more than normal. And so I held a staff meeting. I said, look, guys, I'm having a hard time mentally, and I'm just going to be really upfront and honest with you. If I seem off, if I seem anything, please do not assume that it's you. It is purely me, and I think when we do that, when our staff is going through the same thing, but just like how you said, Sam, I can't go to her. She's the boss. It changes. Angel's gone through some mental health issues. I'm kind of feeling a little off. I think I'm going to go talk to my boss. Hey, guess what? We have an employee assistance program that can help you. Slide that pamphlet right on over. And then that employee is like, dang, my boss cares about me. They got me counseling for my burnout and compassion fatigue. She gave me a mental health day, all because I communicated what was going on with me. Wow.
Yeah.
So
Definitely.
I love that, Sam. I love it. So guys, with that being said, just keep in mind that in order to catch these things, you have to be watching, communicating with your team. The annual performance reviews, take that time to talk to your staff and get to know who they are as people, how they want to grow, how they like to be communicated to, where they want to be, where they want to see this practice go. Your team has ideas for the clinic. They live that day to day. Likely they've been at several practices. They know how to succeed and thrive, and they can make amazing suggestions on things that maybe they want to run with and really take and make it their own. And so like Sam said, talk to your staff, get to know them, let them know who you are as a person, communicate that effectively from the top down, make sure everybody knows their job roles and responsibilities, and don't assume, be an open door and let them have that opportunity. And I think the number one, don't be passive aggressive. Let's address it when it happens. Let's just get it and nip it in the bud. Anybody else got anything before we let these guys go for the night?
I would just say, keep that two-way communication. So like when Sam's saying, and you're having these conversations and not focusing on the review, but opening up, have that open-ended, end it with, do you have any thoughts or suggestions? Do you have any suggestions for the clinic, for the doctors, for me, for our assistant manager? What is some constructive criticism that you can think of for the clinic, and give it to me.
And don't get upset.
You know what? If you don't have anything right off the top of your head, because I'm putting you on the spot a little bit, think about it, text me, call me, tell me tomorrow, whatever.
Yeah.
Leave that open so that they know that you're here to understand their issues and, try to solve them and move forward and be better.
Yes. Don't take things personally as a manager, guys. It's how we grow. It's how we move forward. In general, just don't take things personally. If someone's coming to you and expressing something that they are seeing, take that moment, instead of pointing the finger, look at the 3 that are pointing back at you and say, what could I have done differently so that this disconnect didn't happen? Right. So I love that you said that, Sam. That's why I freaked out. I was like, yes, that's what I'm talking about. This is like, I will sign off with this, is that people like you, watching you grow in the last year, and I hope I don't get emotional, is what gives me hope for veterinary medicine. When I started in this industry 10 years ago, I said, oh my God, we have got some major culture shifts that need to happen in order for this industry to thrive. And you have given me hope that that's exactly what's happening in our practices right now, because I've seen you change over the last year, Sam. I've seen you grow. I've seen you become a stronger, more independent leader. And I'm very proud of you for that. So like, truly, yeah. Woo. All right.
I mean, it
Moving
helps to
on.
have a good network too.
Yes, it does. It does. So I will tab onto that, guys, that not saying that we're 100% Sam's network, but kind of, sort of. And so we do have resources that help you guys with this. We have fabulous performance review templates that make it a conversation and not a review, and make it a moment of growth. So if you guys want access to that, please let us know. Our platinum groups, our VIQ groups that are for our owners, absolutely allow things like this to be talked about, heard, allows you to go back and forth with other managers. So that's my plug there, that there are people who are exhibiting this and performing this in veterinary medicine every day. And if you want to be part of those groups so that you can learn more of what that's like and how to do it, we can get you in those. So just give us a shout, put it in the comments if you'd like to. Sam, thank you for coming on and doing this. Katie, Lindsay, it's always a pleasure. So thank you, Vertical Vet fam. Please give us feedback. Please welcome Sam for doing this for the first time. You did an awesome, freaking fantastic job. I am super proud of you. So thank you, everyone. Have a wonderful evening. I look forward to it.
Bye.
Bye.